Welcome everybody to our webinar for today. We're very lucky to have Melissa Lem. She's the president of the Canadian Association for Physicians in the Environment. Actually, it's a group that I've been a member of for some years and proud to be a member of it. It's a very active group in environmental issues, and I think it's a beautiful marriage actually that we have her speaking to KCOR today, because the two, I think, can interconnect and collaborate very well. We're also very lucky because you already have the background for Melissa's own achievements on the slide in front of you. I'm not going to read it to you, but in addition to that, Melissa has also been an inaugural winner of the University College Young Alumni of an Influence Award at University of Toronto. She won the 2021 World Park Week Ambassador. She sits on the advisory committee of the IUCN World Commission on Protected Areas of Health, and is also on the Wellbeing Specialist Group, and is also a clinical assistant professor of medicine at UBC. And at this point, I'll hand it over to you, Melissa.
Thank you so much, Richard, for that warm welcome. As Richard mentioned, I'm president of the Canadian Association of Physicians for the Environment, but more germane to this talk, I'm actually director of park prescriptions for the BC Park Foundation. And today I'm going to be talking to you about nature prescribing, our program PaRx, and how it's a prescription for patient and planetary health.
Sorry, I'm just going to interrupt for one quick second. I forgot to tell people, if you're going to be asking a question in the chat, just put in a Q before your question so I know it's a question, a C if it's a comment, and to all those participating in this, make sure you mute yourself and turn off your video. Sorry, go ahead, Melissa.
Thanks for that housekeeping, Richard. So PaRx, I'm going to be getting into our program a little bit more later in the talk, but it's Canada's National Nature Prescription Initiative. And my journey to becoming director of park prescriptions really begins in childhood, when I was a girl growing up in the suburbs of Toronto, where I was born, and often felt excluded and isolated growing up in a majority white neighborhood where I was bullied because of how I was different from the rest of the kids. And so I really found solace in my father's garden, where he grew traditional Chinese vegetables and Western fruits and vegetables at the same time, in the bushes, the trees, on the playground, in Bruce Peninsula National Park, which is the first Parks Canada national park that I went to when I was growing up, and discovered stars for the first time growing up with Urban Glow in Toronto. Fast forward to my first job as a rural family physician in northern BC, where I had it was a really tough job. I don't know if anyone else on this call has practiced rural family medicine, but you have to be a Jack or a Jill of all trades. And essentially I was running the emergency department, delivering babies, taking care of sick acute inpatients, and doing village clinics, but I loved it. And looking back, and when I moved to Toronto, I realized that the reason why I loved it so much, even though it was a pretty high stress job for a brand new grad, was that I was surrounded by nature. There were bears walking across my driveway. My commute to work was a 6-minute walk past the hospital garden, and with mountains and mist rising from the river in front of me. Whereas when I moved to Toronto about a year or two later, I found myself suddenly at Yonge and St. Clair, looking at skyscrapers, concrete and glass, with a tiny little square of sky with the CN Tower in it, no longer surrounded by nature. And I found myself much more stressed, and realized one day that it was nature that I was missing, that it was nature that de-stressed me. Even though my work, I hear someone whistling. I don't know if someone wants to mute there. I found myself much more stressed, even though the work itself was much less stressful. I was working as an outpatient student health physician at the University of Toronto. And so I was standing there one day in front of my window, looking at the CN Tower, listening to the noise of the streetcars rumbling by, looking at the concrete. And I thought to myself, do you know what I think the problem is here? Why I feel so stressed and like I want to jump out of my skin is because I think I'm missing nature. But like any good evidence-based health professional or physician, I thought, this can't be true unless it's backed up by evidence. This intuitive feeling that I have cannot be real. And so I sat down in front of my laptop, opened up PubMed, and did a literature review, and was astounded, in fact, by the hundreds of studies that came up describing the relationship between human health and nature, and how it was good for all kinds of different health conditions. And I thought, this was about a dozen years ago now, 12 years ago, I thought to myself, do you know what? I didn't learn about this in medical school. I really don't hear many physicians talking about this on a larger scale. I need to make this my mission to educate my colleagues, the public, decision makers about how important nature is for our health. And so that started my journey. I connected with the BC PaRx Foundation in 2018 when they began operations, and became director of their PaRx prescription program in 2019. And since then, starting in November 2020, we launched in BC first and then spread to every province in the country. And so now I'll just talk a bit more about the health benefits of nature, the evidence base behind that. I'll also speak about how prescribing nature and connecting to it is good for planetary health as well, and then talk about the amazing growth of our PaRx program. So I just want to start by mentioning that nature prescribing is viewed by many as a subset of social prescribing, which the World Health Organization says is a means of connecting patients to a range of non-clinical services in the community to improve their health and well-being. And nature, as we know, is one of those services, along with providing many ecosystem services. And what social prescribing does is it allows provision of more holistic and person-centered care, and it empowers patients to take care of their own health and well-being, which reduces overall stress on health systems and also at the same time reduces overall carbon pollution and resource use in the healthcare system. So this is a nice infographic I like about the process of social prescribing. So you have a healthcare provider, it doesn't have to be a primary healthcare provider, but they assess the patient's need, and then they refer the patient to a link worker typically. So, you can prescribe anything from a cooking class to, a course on how to do your taxes to transportation. In our case, obviously, it's prescribing nature. So you refer them to a link worker who then determines their abilities and what they need, and then connects them to the actual resource in the community. And in our case, the primary healthcare provider and health professional, it doesn't always have to be a physician who prescribes nature through our program, is sort of both the prescriber and the link worker, because thankfully here in Canada, a lot of people do have fairly good access to green space. And so through our program, we connect patients directly to nature to emphasize and allow them to enjoy those health benefits of nature. And then the loop is closed when the patient reports back to their prescriber about the benefits that they've experienced through whatever program they've been connected to. And we are in the process of creating more of an evaluation program for our PaRx program to see exactly what benefits people are enjoying, and have also partnered with a number of different international partners to do more research into nature prescribing itself. So if you think about why a PaRx program, so why the BC PaRx Foundation, which is the official charitable partner of BC PaRx, was interested in creating a nature prescribing program when their mandate is more conservation, is because really the majority of our health status comes from factors outside of our healthcare system. So if you, and also, which I'll get into later, using that health frame is one of the most effective ways to get people to support policy change. So when you think about physicians, healthcare providers coming together with PaRx, and people who really focus on our external environments, it's because they really are responsible for most of our health status. So only 20 to 25% of our healthcare comes from our healthcare system, and everything else comes from factors outside of the healthcare system. So as a physician, if I want to create the most positive impact for my patients, arguably, I should be looking beyond what I do in the clinic. And that's what I really try to do, both with CAPE and with the BC PaRx Foundation. And if you think about how nature interacts with a lot of these different factors that make Canadians sick or well, you can start to imagine why it's so important for us to have high quality green space in our cities, and for people to be able to access nature wherever they are. So I just want to do an exercise with you, and I would invite you to put this word in the chat. To, in one word, describe how you feel when you are outside in nature. And you don't have to put it in the chat if you don't want to. You can also just think it to yourself. I'll give you a few seconds to do that. I see people writing at home, excited. That's an interesting one. Calm and peaceful. I felt all these things myself when I head into nature, at home for sure. observant, and peaceful. I like these words. And so I often do this exercise with people when I give one of these talks. And a lot of the same words come up, from peaceful to calm, re-energized. That might be similar to excited, happy, grounded, wonderful, present. This is a very common experience that we have when we head outside into nature. And the wonderful thing about this intuitive sense that we have that spending time in nature is good for us is that, as I mentioned, it's really backed up by evidence. I see people ready, relaxed, and busy. They feel busy when they're in nature. Your mind's probably wandering back to all the work that you have to do. And so here are just two infographics that I've been given permission to share that speak to all the different health benefits of spending time in nature. So the truth is that there's almost no health condition that nature doesn't make better in some way. So from improved bone density to better immunity, to reduced risk of chronic diseases like diabetes, heart disease, and high blood pressure, to reduce symptoms of anxiety and depression, better symptoms of ADHD in children, less use of pain medication and earlier discharge from hospital after surgery, better work satisfaction, and the benefits of nature time for human health, whether you're an adult or you're a child across the lifespan, are almost endless. And so the question is, a lot of us are educated in science or we're healthcare professionals. What exactly is it about nature that is so good for our brains, that is so good for our bodies? And so one of the theories, it's called attention restoration theory. So currently 70%, 60 to 70% of humans across the world live in urban settings. And unfortunately, our brains haven't evolved quickly enough to be able to deal with these urban settings in most cases and feel at home in them. So attention restoration theory says that when you spend time in busy urban environments, the lights, the sounds, the crowds, the traffic actively tax our focus and our ability to direct our attention, because we have to navigate around so many obstacles. And so this taxes our attention, this increases fatigue and irritability. Whereas when you spend time in nature, it's a source of soft fascination. So it's interesting, but it doesn't constantly tax our powers of conscious attention. And so what that does is it restores that attention and it reduces that fatigue and irritability. The second theory is called stress reduction theory. This says that when we experience something stressful, spending time in nature actually allows us to recover from that stress faster. And some scientists think this comes down to an evolutionary perspective. So if you think about it, if you're an early human and you were in a biodiverse environment, it would have everything that you need to survive, from sources of water to food to trees that you can create shelter out of or climb up to get away from predators or look out to where your community was going to migrate to next. And so our brains evolved to want to spend time in these biodiverse environments and sent these signals of calm, of de-stressing when we were in these areas that were good for our survival. So essentially, these early humans have passed down their nature-loving genes to us, even though we live in cities. There are also all kinds of other biological and physiological theories as to why, theories and actually evidence as to why we feel better and why we're healthier when we're in nature, from the phytoncides that you breathe in, which are volatile organic compounds that plants and trees release that actually kill insects, but in fact boost our immune systems. There are also healthy bacteria that we contact when we get our hands in the soil, and especially when children with their evolving immune or with their developing immune systems actually experience, which shunt them down the healthy immune system side and not the allergic immune system side, for example. There are actually experiments showing that just the smell of nature, the smell of these phytoncides outside of the forest itself can actually boost your immune function as well. And research showing that just the sounds of nature, whether it's running water or the wind in the trees or birdsong, can improve markers of mental health. So from your head to your toes to your nose, spending time in nature is one of the best things that we can do for our health. So I just want to get into some of my favorite research studies that have to do with the health benefits of nature. And I like this one because it's from my hometown, Toronto. And it also is interesting because it quantifies objective nature and compares it to things that we know, factors that we know are related to health outcomes. So this was a study in Toronto, and what it did was it combined high-resolution satellite imagery, individual tree data, and Ontario Health Study data and self-reports of health perception. And what they found was that 10 more trees per block improved people's health perception, similar to an increase in their personal income of $10,000 per year, moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. So this is, again, fascinating because we know that income and age are both strongly correlated with health outcomes. So I like how they, again, compared something very quantifiable like tree cover to income and health. And unfortunately, in a lot of our cities, almost every city in Canada, the amount of tree cover and green space tracks quite closely to level of income, and also how, what percentage of people in that area are white. So in fact, we have created inequities in nature access in many places within our cities across Canada, and it's not a coincidence, unfortunately. So I like this study because it speaks to nature as medication. So this was one that was done in Chicago, and they took 17 kids with ADHD on 3 different 20-minute walks through a city park, through a downtown area, and through a residential area. So the same child, 3 different walks for 20 minutes. And so what they found was that the 20-minute walk in the park improved their digit span backwards performance, similar to levels in children without ADHD. And in fact, when they crunched the numbers, they found that this effect rivaled the peak effects of prescription stimulant medication like Ritalin. And this is an interesting study because a lot of people often ask, okay, is it the exercise part that's improving their focus and their cognitive function? Is it being outdoors in the sunlight? But this one took all those factors away because they all got the same amount of exercise. They were all outdoors, but it was actually the park walk that significantly improved their digit span backwards score. So in case you don't know, the DSB score, essentially you recite a sequence of numbers in a row. You get the participant to recite that sequence of numbers in backwards order back to you. And the higher number of digits you can remember, the better your concentration and attention. So again, the park walk rivaled the peak effects of Ritalin. So no one is saying that a 20-minute walk in the park is going to do everything that prescription medication is going to do. But I think it speaks to how powerful nature time can be as an adjunct to what we traditionally prescribe in the medical system. So here's another opportunity for audience interaction. And again, as a physician, the question is, how much do I prescribe at a time? If I'm going to prescribe something, typically there's a dose and there's a frequency. And so in the last few years, in fact, this information about dosing has emerged. So I want you to enter into the chat which number you think is correct. So people report significantly better health and well-being after spending how much time in nature per week? Is it 1 hour, 2 hours, 3 hours, 4 or 5 hours? And if, again, you can think it yourself or enter it in the chat if you want to participate that way. Okay, I have a 1 hour, I have a 2 hour, I have a 3 hour, a 2 and a 1. Okay, well, the actual answer is 2 hours. And this came from a pretty big study that was done in the UK in 2019, right as we were creating our program. So this is very convenient. This is a study of almost 20,000 adults in England, and they asked them how much recreational time they spent in nature per week and they controlled for a number of other factors like age, income, current health status, access to green space. And what they found was that their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 120 minutes per week. And as you can see from this plot here, the benefits sort of continued to accrue past the 120-minute mark, but they peaked at the 200 to 300-minute mark per week. And so, this is why we have a standard recommendation in our program that people spend at least 2 hours in nature each week. If you want to spend more time in nature, of course, we encourage that, but we ask that people aim for at least 2 hours to experience those significant health and well-being effects. Time for another poll. So again, we're prescribing a total of at least 2 hours per week, but how much nature each time is effective? And this is a bit of a trick question because there are studies showing that even just 5 minutes sitting outside can improve outcomes, but we want the biggest bang for our buck in terms of stress drop. So the most efficient drop in cortisol levels happens between how many minutes in nature? Is it 5 to 10? Is it 10 to 20, 20 to 30, 30 to 60, or 1 to 2 hours? And you can just put which number you think in the chat if you'd like to participate. Okay. Most people, well, there's a pretty good spread here. Some people are saying 10 to 20, 30 to 60, and a couple of people say 20 to 30. So the actual answer is 20 to 30 minutes. Oh, I see someone writing on the screen now. This is interesting. Or maybe, anyway, maybe that's some artifact. Anyway, so I see a couple green marks on my slide now that I think someone may have written, but I'll just continue. Anyway, so this recommendation comes from a study that was again released in 2019. And they had 36 urban dwellers over 2 months, and they asked them to have a nature experience in an outdoor place that brought them a sense of contact with nature at least 3 times per week and for 10 minutes or more. And the interesting thing about this study was that they asked them to self-define. So they said, you know, we're not going to ask you to go to this particular park away from people or without traffic noise. They said, if you feel like you've had a meaningful nature experience, you log it and you check your salivary cortisol levels. And so what they found was that the participants' cortisol or stress hormone levels were more than 20% lower after a nature experience compared to a non-nature experience. And the efficiency of that nature pill was greatest between 20 to 30 minutes. So as you can see from this red discontinuous line here, the biggest drop is between that 20 to 30 minute mark. So a lot of us are busy. We have a lot on our plates, too much on our plates most of the time. So if you want the biggest bang for your buck in terms of stress reduction, we recommend that you spend at least 20 minutes in nature each time, but anything is better than none. It also is very convenient because it's very easy to remember. The recommendation: spend at least 2 hours in nature each week, at least 20 minutes each time. And if we're prescribing something to patients, it often helps to have something that's easy to remember, but that's also backed up by evidence. Something else quite convenient about this recommendation is that we know that Health Canada's recommendations for physical activity are that we spend at least 2.5 hours doing moderate to vigorous physical activity per week. So if you can think about spending maybe 2 hours of that or more outside in nature doing something, that'll supercharge the positive effects of exercise. Okay, and I alluded to this a bit earlier as to why the BC Parks Foundation is interested in launching a nature prescription program. It's because it actually supports the goals of conservation, because health it has been shown in a lot of research to be one of the most effective frames to motivate people to support policy and action. So we can take some of these lessons from the research base on climate change. This was a study, a multi-country study that was released. The results were released in 2021. They conducted surveys with more than 7,500 participants in 5 countries, and they asked participants to read 5 pairs of statements and asked them which of the 2 statements would make them more likely to support policies tackling climate change. So they used economic versus environment framing, or health framing versus economic framing. And what they found was that in the greater pool, health and environmental framing around policy proposals increased support for these proposals. Economic framing had no effect on people's support, which is interesting because you think about how often government talks about the economy. In fact, for the average person, they don't care as much. Opportunity framing, so talking about the positives of this policy proposal, increased public support in general more than threat framing or the negatives of this proposal. And also present impacts were more motivating than future impacts, so focusing on current benefits versus what would happen in the future. And that's really what we try to do with park prescriptions, is to focus on current health impacts and opportunities in public policy messaging because they're more motivating to change behavior. You'll notice that I put 2 little stars on health and opportunity. And in fact, in people who weren't concerned about or didn't care about climate change at all, in fact, health and opportunity framing were the only 2 kinds of framing that increased their support. So if you want to bring in a larger tent of people, just keep this in mind in your future work. Use health, use opportunity framing, and you're more likely to move a larger number of people. So, you know, I'm president of the Canadian Association of Physicians for the Environment. I'm glad to have Richard on board with CAPE. I've been a member since I was a medical student 20 years ago. And one of the reasons why I'm so passionate about connecting people to nature is because the research base indicates that it's good for the planet as well. We know that healthcare is a major contributor to global carbon dioxide emissions. If healthcare were a country, it would be the 5th highest emitter in the world. So anything that in an evidence-based way is going to improve our health status is going to, at the same time, reduce the burden on the healthcare system, reducing our overall carbon pollution and resource use. We also know, I'll get into this a bit more later, is that urban nature itself makes cities healthier, both by increasing the health status of people within them and leveling out those health inequalities between people of different incomes in the same neighborhood. But it also makes the cities from an infrastructure perspective healthier. So again, I'll talk about that more in the next slide. We also know that children who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. And so research indicates that people who are more connected to nature don't only support conservation, because that totally makes sense that you want to protect what you love, but they also engage in more other pro-environmental behaviors beyond conservation. They tend to conserve more energy. They tend to recycle more. They tend to vote for more climate advocates. So I like to think that every time one of our prescribers in our program prescribes nature and connects a patient to it, that they're actually doing something for the planet, something small for the planet at the same time. Also, the executive director of the UN Environment Program, Inger Anderson, has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So it's a fact that there's no way that we can get to net zero by 2050 without engaging nature-based solutions for climate change that focus on restoring and expanding nature, whether it's wetlands, blue space, or green space, while dealing with human issues at the same time. And so it's estimated that if we fully embrace nature-based solutions for climate change, that this could get us over a third of the way towards our 2030 Paris Agreement targets by that year. And if you look at overall global climate investments in nature conservation, it's probably more on the order of under 5% of all climate investments. So if you think of this potential of a 30% reduction in carbon versus a 5% of overall investments, you can imagine how levering the health voice and the health frame to increase support for conservation would help close that gap among decision makers and funding internationally. So just a bit about how tree cover and green space in cities is good for infrastructure. So there are a number of different benefits for urban greening. So trees create shade, which reduces the need for air conditioning, and especially if your electricity grid is not powered by renewable energy, like we have in BC, over 90% of our grid is renewable energy, then you're reducing overall use of fossil fuels and carbon emissions. Lowering energy demand in, again, places that use gas or coal or other fossil fuels to create electricity also reduces air pollution and greenhouse gas emissions. Trees and green space remove air pollutants. They also sequester carbon dioxide, and they reduce flooding. So it's estimated that every $1 invested in a tree returns up to $3 in benefits. And I know, that we talked about how economic framing doesn't move the average public. It certainly moves government. So highlighting the economic benefits of green space in cities can be a good way to move decision makers. This is a map I want to mention of how, of what happens when the lower mainland of Vancouver heats up. And this is a map of the heat that was experienced during the 2021 heat dome that we saw in June and July that unfortunately killed over 600 people and over 100 people within Vancouver itself in the space of a couple of weeks. And if you look at this red area, this is the downtown east side, which is one of the most economically depressed areas in the city. And in fact, the majority of hospitalizations came from the downtown east side, where in fact, there are some of the lowest percentages of tree cover in Vancouver Coastal Health Authority. And so it's no coincidence, again, that there's less tree cover in this area and that people's health outcomes during the heat dome were lower. So again, when we think about green space and tree cover in cities, we have to think about increasing it in these lower income neighborhoods that are essentially urban heat islands, because people's health is being affected in real ways already. So I want to talk a bit about a guideline that we can think about when we want to consider greening our cities. And this is a guideline that was created by a colleague of mine, Dr. Cecil Konynendijk, who used to work at UBC in the forestry department, but now works in the EU. And he created what's called the 330-300 rule. And what it says that everyone, to optimize health status, green space status, tree cover within cities, everyone in ecologically appropriate areas of the city, because obviously, like in Yellowknife, we're not going to have 30% tree cover, but everyone should be able to see at least 3 trees from their windows. And there should be at least 30% tree canopy across neighborhoods within the city. And everyone should be within a 300-meter walk from a high-quality large green space. And there's in fact evidence to back up these metrics. And I just want to talk a bit about this really compelling evidence that comes from colleagues in Australia, particularly with the 30% tree cover statistic. So this is an amazing group that does a lot of research into health and nature, and they've analyzed different diseases and what the differences are in prevalence of these diseases between areas of cities with 0 to 10% tree cover versus 30% or higher tree cover, again after controlling for a number of different confounders like income and other and health status. So what they found is that in areas of the city that have 30% tree cover or higher, that there's a 31% lower risk of diabetes, 22% lower risk of heart disease, 17% lower risk of hypertension, 31% lower risk of psychological distress, 13% and 25% lower risk of poor sleep and loneliness. And so if we think back to all the different ways that I described that nature can improve our health and all the research behind it, again, increasing nature in our cities, increasing tree cover is a way to improve the rates of non-communicable diseases as well, as you can see. So now I want to talk about, coming to my favorite part of this talk, because I'm so proud of this initiative, is our nature prescription program. So this is a program where regulated health professionals within Canada, so it could be any physician, nurse, occupational therapist, physiotherapist, registered clinical counselors. If you are regulated and licensed, you can sign up to prescribe nature through our program. And if you're interested in learning about our program, our English language website, which covers 9 provinces, is parcprescriptions.ca. And we were very proud to launch Prescrit Nature in Quebec in May of 2022, making it a bilingual program. So if you sign up for a program, you'll have access to our resources. And in fact, you can access the resources on the right-hand side on our website without registering, but you'll receive a customized nature prescription file with your unique prescriber code on it. So you can log prescriptions and prescribe benefits, which I'll talk to a bit more later, with our standard recommendation for at least 2 hours a week and at least 20 minutes a time at the top to make it easy. And it's a process of talking with your patients about their abilities, what their schedule is like, what kind of nature they have in their local environments, and then coming up with a plan that works for them to incorporate nature time into their everyday lifestyle. So again, it's anything that makes them feel like they've had a meaningful nature experience, from gardening to spending time in a local park to going further afield to a larger park. Whatever works for the patient is what's best for them. And then on the right-hand side, you can see one of our 14 different fact sheets that are broken down by different health issues, both adult and pediatric, that explain our recommendations and the evidence behind it, and then also zero in on the evidence behind the benefits of nature time for specific disease conditions. So we have respiratory health and immunity, we have cancer care, we have prenatal health, for example. So anyway, I'd encourage you to explore our website and check those out if you're interested in some evidence behind the health benefits of nature. Okay, so this slide just shows the broad-ranging endorsements and support that we have across the country. So our criteria for launching in a province is that we get endorsements and support from at least one major physician organization and at least one major nursing association in the province, because the majority of our prescribers are physicians and nurses. So we have major endorsements from physician, nursing, and other kinds of allied health professional organizations in every single province where we've launched, where we're in contact with their members to increase prescriber numbers and again, educate them about the health benefits of nature. We were really, really proud when at COP26, so 2 COPs ago, the World Health Organization specifically pointed out our nature prescription program as one of only 2 case studies, in fact, from North America mentioned in their COP26 special report on climate change and health, of health initiatives, health-based initiatives that were also improving climate change at the same time. So they pointed out PaRx as an effective way to inspire protection and restoration of nature as the foundation of our health. So we were very proud of that. And that kind of set off this wave of international attention, which was really amplified when we created a partnership with PaRx Canada. So I just want to pause there, in fact, and share a video that the World Economic Forum put together after we got a lot of publicity about our partnering agreement with PaRx Canada. That speaks to our program and also the benefits of nature that was essentially inspired by everything that we had on our website. So I'm just going to share this really great video with you right now. Okay, just going to navigate back to my presentation here. So as that video from the World Economic Forum mentioned, we have a partnership with PaRx Canada that we established in January of 2022, where any regulated health professional in our program can in fact prescribe a free annual PaRx Canada Discovery Pass to their patients to tangibly reduce a barrier to nature access. Because it's one thing to prescribe nature, but another thing to actually make it easier for our patients to access it. And so this, this really made our initiative kind of go viral across the world. We had, I believe it was over 200 million people across the world were exposed to evidence on the health benefits of nature as a result of media coverage of our program. There are over 100 different media pieces in, basically every continent across the world, other than Antarctica, I believe, about our nature prescription program and our partnership. So it really, I think, put PaRx prescriptions and honestly the beautiful nature of Canada on the map in a major way. Okay, and so I just want to show this slide that indicates how much growth we've had. So in November 2020, as I mentioned, we launched PaRx prescriptions in BC, and we had steady growth. And I will mention, so by about 1 year, we registered about 1,000 prescribers in our program. And then in comparison to PaRx America, we have, a great relationship with them, and I know their leadership. They took about 3 years to register 1,000 patients, despite having a much larger prescriber and patient base. So we were doing pretty well already. And then in 2022, we announced our collaboration with PaRx Canada, and that set off a phase of exponential growth, as you can see. So right now, across Canada, we have over 10,000 regulated health professionals prescribed in our program. This includes over 5% of all physicians in the country. And within my home province of BC here, over 15% of all practicing physicians have registered in this program. So if you think about how typically physicians are fairly slow to adopt new practice innovations, I think it's just astounding how much support there is within the health community for this concept and this initiative. And you can really see it in the number of prescribers that we have. Another real point of celebration we had was at COP15, so the UN Biodiversity Convention, the biodiversity version of the climate COP in Montreal in December, when nature prescribing was officially, so PaRx was officially endorsed by the Canadian Medical Association in Montreal, and that's our CEO, Dr. Andrew Day, speaking to the crowd there in the Canada Pavilion. And this is the first time that a national nature prescription program has been formally endorsed by a national physicians association in the world. And in fact, the Canadian Medical Association formally recommended nature prescribing in their environmentally sustainable health systems in Canada policy in October. So they've formally recommended that every medical student and every practitioner adopt nature prescribing into both education and practice as a way to improve sustainability and environmental stewardship within healthcare. And so this is, again, the first time that this kind of recommendation has been enshrined in policy. And in fact, over and above what we've managed to do within the health community, we've also been catching the attention of decision makers. So I just want to share, in fact, a video that our current Minister of Health, Jean-Yves Duclos, put together to show their support for our program at COP15. And I will mention that we did a number of different presentations at COP15, and one of the vice presidents of PaRx Canada was present at one of our sessions, and he mentioned that, in fact, our program and the partnership had created a major culture shift within PaRx Canada itself. In fact, their employees, their different field units were now talking about how important nature was for health, and to convey that messaging more in the programming that they offer. So, you know, almost every day I hear from a patient or a colleague or a prescriber who mentions how our PaRx prescription program is positively impacting the culture and health of patients and their communities in major ways. So we're just excited to see where this goes next. So I'm just going to share with you Minister Duclos' video. Here we go. Oops, not that one, this one.
Bonjour à toutes et à tous. Je suis Jean-Yves Duclos, ministre de la Santé du Canada. C'est un plaisir de vous accueillir à la COP15 à Montréal. Cette conférence est une occasion majeure pour nous de discuter, d'apprendre et de convenir des solutions pour un environnement et une population en meilleure santé. As I often say, I'm not the Minister of Healthcare, I'm the Minister of Health. And as the Minister of Health, I am keenly aware of the critical link between health and the environment. In fact, 80% of human health outcomes are determined by factors that have little to do with healthcare. Our lifestyles, the environment we live in, and the health of our communities are all interconnected. That is why I'm so grateful for the work that Melissa and the PaRx team are doing to promote sustainable health and physical activity. It is truly inspiring to see so many physicians, researchers, and activists engage in this important work. As many of you know, 15,000 people die each year due to air pollution, and 36,000 die each year, in part due to their food habits. These statistics are frightening. Yet I know that through your hard work and all of your continued engagement with our government, we can and will be able to deliver better outcomes. En promouvant des modes de vie sains, nous pouvons contribuer à améliorer non seulement notre santé, mais aussi celle de notre environnement. Et pour ce faire, nous avons besoin de leaders comme vous. J'aimerais enfin vous partager une belle citation de collègues de l'Université Laval. La santé durable, c'est un esprit sain dans un corps sain, dans un milieu de vie et un environnement sain, sur une planète en santé. Je vous remercie, toutes et tous, de votre leadership et votre partenariat à cette cause importante. Ensemble, je sais que nous pouvons faire une réelle différence pour la santé et le bien-être des Canadiens. Merci, thank you, miigwech.
I just love that video because I think it shows how much Health Canada in particular is on board with this messaging that planetary health is incredibly important. And it's wonderful that our program could be an in for the Minister of Health to express these concepts on this international stage. So I'm really grateful for the opportunities that we've had and the support that we've had. All right, so the question is, what are our next steps now that we've done this? So we are still planning to launch PaRx prescriptions in the territories. So we're connecting with Indigenous peoples and different health leaders up there to figure out how to launch it in a good way. We are also collaborating with a number of other organizations, including transportation organizations and community and nature-based ones to further reduce barriers to nature access. So we don't only have a partnership with PaRx Canada, We also, for example, patients who show their nature prescription at the gate can get free admission to UBC Botanical Gardens and Etobicoke Gardens, or discounted admission to a number of other nature and outdoor venues on Vancouver Island and within Vancouver. We're also expanding to Ontario. We're in talks with a couple of major nature-based organizations to offer discounts to our patients from their organization. So if you happen to know one, certainly connect us. And then we're also planning in the next few months to launch our PaRx Prescriptions mobile app, so phone-based app to track and incentivize nature time, and we'll start to be able to build that data to support the idea that nature prescribing is good for health. I should also mention that we're international advisors and co-investigators in a number of international trials. One major one in the EU is, I think it's 7 million pounds. Anyway, but we're continuing to contribute to the evidence base around the health benefits of nature and nature prescribing. So I want to share one more video, and this really encapsulates why we do what we do in our program. And the reason why is because it actually improves real people's lives. This is not just a nebulous concept. I speak with patients whose lives have actually been improved by the nature that my colleagues and I have prescribed to them. And so I want to share the story of Marjorie Sherman. She was actually one of the first patients who was prescribed nature in our program by one of my colleagues. And she was kind enough to share her experience.
About a year ago now, I was in talking to my doctor and I just said, I can't shake this depression. He says, I've got just the thing, a prescription for you. I thought, oh goody, one more pill. And he says, no. I want you to spend 2 hours during the week outdoors, minimum 20 minutes each time. And the more I did it, the better I felt. So it all came together way better than any medication I've ever had.
Now, you know she's 75, so I'm going to tell you that I'm 91. So that's why she takes care of me.
I do try.
Nature is everywhere. We can find it in the most unexpected places, and nature is health. PaRx Prescription, or PaRx, is Canada's national nature prescription program. What the physician or nurse does is they sit down with the patient and they figure out what kind of nearby nature is in their community, and then they work with them together to come up with a plan where they can incorporate nature time into their everyday lifestyle.
Some cherry tomatoes. So this is the prescription, and it just gives my name, and it says my outdoor activity plan.
In 2022, we announced a new collaboration with PaRx Canada, where licensed health professionals can now prescribe national discovery passes that give you entry to national parks. There are only 2 national nature prescription programs in the world, and the first one was actually founded right in the US. Cost can be a barrier where there are day use fees, so we're hoping that by prescribing these PaRx Canada discovery passes, that will reduce that barrier to nature access in a significant way. Well, there are 2 major theories as to why nature is so good for our brains, and the first one is called attention restoration theory. When we spend time in busy urban environments, all the hard edges and traffic and lights and people everywhere really make us have to constantly focus our attention to kind of navigate around those obstacles. Whereas when you spend time in nature, it's really this source of soft fascination. So what that does is it restores your powers of attention and it reduces that fatigue and irritability. The second major theory is called stress reduction theory. So basically, when we spend time in nature after stressful events, it helps us be more resilient and recover faster. When I recommended nature for the first time to a patient of mine, I thought he's going to look at me funny and he's going to laugh at me. But he actually just nodded his head and said, you're absolutely right. When I spend more time in nature, I feel better. And so I think healthcare providers sort of have to get over our own mental biases against new sort of lifestyle interventions and prescribe something evidence-based like nature time more often.
50 days from seed to vegetable. I think the prescription helps in that it says this is a good thing to do, this is worth the effort to do. You need to get out of doors and just be surrounded by the greenery and by nature.
I want people to know that nature should be a non-negotiable. The thing about heading outside is that you tend to start to naturally be more active. You'll feel calmer, you'll feel less depressed, less anxious. I think it's just a great way to deal with the stresses of modern life.
Makes me smile every time I hear Marjorie talk. Okay, so just to sum up here, our key messages, the key messages from this talk are that prescribing and spending time in nature are simple and effective interventions for improving patient and planetary health. Urban green spaces and tree canopy are essential for health. Remember that 330-300 rule. And there's an established and growing body of health professionals prescribing nature across Canada. If you are a regulated health professional, please join us or spread the word to people you know, at one of our websites, parkprescriptions.ca or prescreennaturaux.ca. Thank you so much for your attention and inviting me to speak.
Thank you, Melissa. So I think at this point we can get into the Q&A portion of our discussion. Peter Bukulski, I think you had the first question. Meanwhile, if anybody else has questions, they can start sending them to me. And Peter, go ahead.
Hi, Peter Bukulski, chemist. I've just gone through rereading Ben Goldacre's book on bad science. I'm a scientist, not a chemist. I recognize some extreme difficulties in doing a lot of studies and in separating cause and effect versus just coincidence. Like one of the first studies that you had 17 participants with subjective outputs. Can you really take that as a true measure of cause and effect? How do you deal with that? How do you deal with the nature studies without a double-blind approach? And I don't know how you do a double-blind approach in that type of test. So.
Yeah, this is a great question, Peter. And so this is a study, I don't know if you want me to put my slide back up here so that people can see it, but I typically give this talk to more of a lay audience, and I really appreciate your scientific approach and your question here. So in terms of this study in particular, I think one of the questions was if it reached significance, and in the study it did, just as you can see. So this bottom error bar is above the top error bar of the neighborhood and downtown walk. But this was a very small pilot study, obviously. But there are lots of other studies looking at cognitive benefits of nature time, from functional MRI studies, looking at which areas of the brain light up when you're exposed to nature scenes or after a nature walk versus an urban scene. And it consistently shows that the areas of the brain associated with fight and flight tend to light up more after urban experiences versus, the rest and digest with nature experiences. And so this is not the only study that has to do with ADHD. In fact, there's a pretty significant body of evidence on children's mental health and cognition and nature. So if you're interested, I'm totally happy to share those slides. And if you go to our website, in fact, I think there's a whole sheet, like a handout on school performance and children's mental health. And so again, this is not the only study, but I think it's interesting, particularly for a lay audience, because it compares nature time to medication with, some internal controls, like, city park, downtown area, residential area. It separates that effect of being outdoors and exercise, which a lot of people often point to as a benefit of nature. But it looks like there's a benefit to nature over and above just being outside in the sunshine and over and above just being active.
Thank you.
Dave Doherty, you're next. Sorry, I didn't get a chance to tell you.
No worries. Okay, so Melissa, thanks for the very interesting talk. I spent about a decade at Health Canada trying to influence health policy in Canada towards many things that are directly related to what it is that is of interest to CAPE and PRX. But I came away from it with a very negative feeling. And my question is this: are politicians really interested in having healthier citizens? If so, surely they would be addressing all social determinants of health.
This is a good question. I think it depends on the politician. You know, I interact with a lot of decision makers, never worked formally for Health Canada or within government. I think some, well, I don't want to be negative, but, you know, some more are not as invested in their work and others are. But I think the truth about what we're seeing right now is that we can't ignore the effects of climate change or the negative effects of not having green space in our urban settings anymore. With the deaths that we saw during the heat dome on the West Coast, people woke up. This information about green space being directly related to mortality risk came out actually out of a study by the BC Centre for Disease Control. So it's a really credible resource. And I think, again, as the effects of climate change come home to roost, it's impossible to ignore. It's costing a huge amount of economic damage. In fact, with the flooding that we saw at the end of 2021, it was the most expensive extreme weather event in Canada's history. So it's coming to bear. The health effects of climate change are happening at the same time the economic effects are happening. And so I think even if, you know, people don't have ministers don't have an individual vested interest in people's health, I believe our current ministers do. I've interacted with Minister Guilbeault and Minister Duclos a few times. I think they do care about their jobs, and I think they do care about improving the health of people and the planet. So anyway, but for others who may not be as interested, it's impossible to ignore now. So it has to be part of their jobs because it's so in our faces.
Quick follow-up then. How might we influence the ministers that you have mentioned to stop doing things like new pipelines, new exploration for oil and gas, new compressed natural gas shipment facilities to send this material all over the world, which of course will come back to haunt us?
Mm-hmm. Using the health frame, you know, like I mentioned, it's something that the public responds to. And if we create enough noise as trusted health professionals, I didn't mention that you know, there are these annual surveys, global surveys done of who the most trusted professionals are, and doctors and nurses consistently come out on top. So if through CAPE, if through, you know, being a nature prescriber with the BC PaRx Foundation, if you are constantly making noise, meeting with decision makers and writing op-eds, speaking in the media, there's potential for us to shift, you know, the needle. But I recognize this is really difficult. Obviously, the fossil fuel industry has way more funding. You know, it isn't like volunteer doctors off the side of their desk meeting with decision makers. They actually have paid lobbyists that I think, you know, outmeet NGOs and charities at least 3 or 4 to 1, if not more, within Canada. So I think we do what we can. You know, we realize that there are economic situations out there and different powers that we may not know about, but we just keep agitating. We keep raising our voices, writing letters, making a stink in public, and meeting with these decision makers directly, or, you know, working from within, like you did with Health Canada, trying to raise awareness internally.
Great, thank you very much.
Art, you're on next. Go ahead.
Okay, thank you. I must apologize. I had to step away from your presentation for a bit, and perhaps you covered this, but in Japan, it is a cultural thing for people to go and have, I think it's called a forest shower, because of the gases that are given off. And this is regarded as a stress reliever and good for their health. And it's very common. It's built right into the culture. Are there other parts of the world that you know of where this relationship between nature and individuals' health is that embedded into their culture?
Yeah, Japan is famous for Shinrin-yoku, or forest bathing. And this was in fact a practice that originated in the 1990s, although their spiritual practices really do embrace the intersection between humans and nature. And it was a response to intense urbanization and all the stresses that came along with it. And so I think it was their health type ministry said, getting people back to the land, back into these forests is going to be a way to counteract the health effects of urbanization. And so they created these forests, these centers in Japan where you can go and have a forest bath. And it's really interesting how they also take like hard measurements of your blood pressure, your heart rate variability, and that sort of thing, pre and post your cortisol levels. Like they actually will measure the change in your status before and after, probably to prove to participants that there's actually some kind of effect that's happening. But yeah, so Japan is one. And, you know, if you think about cultures around the world and countries as a whole, I really need to point to Indigenous peoples who have carried forward this philosophy for, you know, since time immemorial. And it's really modern healthcare that's rediscovering this. I know there were, you know, in the past, sanatoriums and places where people would go outside, you know, to improve the health and immune system of young children who were sick and older patients as well. So it's something that did sort of have a resurgence within North America and Europe for a while, I think, in the, you know, 19th and early 20th centuries. But we sort of lost that in the mid 20th century. And so what we're trying to do is to speak the language of current health care professionals and get more people on board with the idea that spending time outside is useful. But you know, there's a book, it's called The Nature Fix by Florence Williams, who I actually interviewed for our most recent PaRx blog. And she actually goes through, she traveled around the world to a number of different countries and experienced nature in Finland, for example, spoke with doctors in Scotland, ones in the US, for example, who are doing this kind of work on a smaller scale. But there, like I mentioned, there are only 2 national nature prescriptions in the world, but a whole lot of other kinds of nature and health initiatives that are present in other countries, including in Japan, as you mentioned.
Okay, thank you. Good answer.
Okay, all right, were you finished? Yeah. Okay, so I just have a question for you, Melissa, a couple questions. One is, are you a member of CANU, the Canadian, for those who don't know, who are listening in, the Canadian Urban Environmental Health Research Consortium? Because the data that, if you're collecting data on the outcomes of the patients and their time in the environment, and because that's what the CANU is all about, is trying to collect that data, and it's funded by the Canadian Institute for Health Research, for those who don't know, and it's very powerful. So the more data we can get in, the more we can twist the arms of those who are policymakers. So that's my first.
So I'm not a member of CANU, but it sounds like it would be valuable to be a member of CANU. Yeah, do you know what's funny is the attention in our program has really come internationally. Like we are, you know, we collaborated on a grant application to CAHR and this body in Australia to fund a nature prescription trial for a chronic disease like diabetes within Toronto. That wasn't successful, but you know, there are 2 major multi-million-dollar trials that have been approved in the EU and Australia that we're part of. Canada's a little bit behind, I guess, in terms of that area, but I would love to see more research. There's kind of smaller scale studies happening within Canada, but no major body, I would say, that's investigating this right now within Canada.
I'll link with you afterwards by
Sounds
email.
good.
There's a lot to talk about. But the other thing that caught my attention, well, there's 2 things. One is last year I gave a talk on the link between environmental toxins and health outcomes. And it's very interesting. In the tape you showed, here we have the health minister talking about how important the environment is for health. Yet we have a whole body of people from across the country who are willing to contribute data on health outcomes and exposures to health environmental toxins. We've been to the assistant deputy minister, and yet we haven't been able to get it launched. So although he says he's supportive of, you know, doing something for environment and health, this thing we haven't had. We have collaborators from all across the country who've said they wanted to do something like this, and we haven't got the funding to get it off the ground.
Richard, can you explain a bit more what this is that you're trying to get funded?
It's the Canadian Environmental Health Information Infrastructure. So actually what it would do is link exposures to environmental health, environmental toxins and their adverse health outcomes. And then actually the data that we would collect, which would be put through a supercomputer with a very sophisticated data mining, so forth, and then actually be able to then feed that data back to the people who regulate environmental toxins. That's what we're hoping to do. And we have support from all across the country. But so far, and we actually spoke to one of the senators who was trying to put through something last year. He was very supportive, and yet, and I having spoken to the ADM of Health a couple of years ago, all of them were supportive of doing something like this because it would feed science-based, evidence-based data to the regulators, and yet we haven't been able to get it off the ground.
Mm-hmm. It's tricky. I can think of a number of reasons why it'd be hard to fund something like that, is because, it's obviously not a positive for industry. They'd like to hide the health effects of their, toxic releases as much as they can. This is something that we've been actually trying to advocate for within BC, with my CAPE hat on now. There are a lot of people in Northern BC, Northeast BC reporting negative local health effects of hydraulic fracturing, which is the process used to, produce the majority of natural gas within BC. And, from high rates of brain cancer to, fatal lung disease, it's not being, documented, cataloged. Toxic investigations are not being done. Toxicology investigations are not being done on these patients. But again, it's not in industry's interest to fund that, and not necessarily in government's interest. But CAPE actually has an active toxics program. I don't know if you know, our toxics director is Dr. Jane MacArthur, and she might be interested in hearing about your initiative. Yeah. It's certainly something that CAPE might be interested in supporting.
Sure. No, that's great. That's good to know. So I'm just trying to follow all these questions here now all of a sudden. John Hollins, go ahead.
John? Sorry, I wasn't ready. Thank you so much. I was fortunate in going to a school which at the age of 14 years took me on a hiking trip to the Lake District of England, a magnificent place, as you may well know. And what you've done, that was 70 years ago, by the way. And I still remember climbing Cat Bells, a relatively modest mountain. Perhaps that got me going, but what you've put into words and pictures this afternoon captures what I understood with that, never having stated it the way that you did. So that was really helpful. The other really helpful thing you did was talk about framing of messages for general populations. I was not aware. My primary interest for 3 decades has been global heating. And we have what you've played back to us, something that we should probably be applying in our ongoing advocacy about global heating.
Yeah, I know, John, and I feel like environmentalists have been barking up the wrong tree for a long time. They've images of polar bears, images, people don't really care. Like the average person doesn't really care about that. They care about their own health and their family's health. And they want to tune out doom and gloom. So the more we can focus on opportunity, the more we can focus on the health impacts, I think the better we'll be off. And I think the environmental movement is just catching up to that. CAPE is now getting inundated with requests from all these environmental organizations asking to partner because they're realizing how powerful that health framing is and how powerful the health voice is. So yeah, I'm glad you found something useful for my talk. I appreciate those comments.
Okay, thank you. Mike Nickerson, you're up, and then after that is Phil Riley.
Great. Well, I was delighted. We were driving through a snowstorm listening to you explaining your program, and it's for me it's self-evident. I just instinctively moved out of the city. I make furniture, and I could do that anywhere. So I advance that way. I have a couple friends who make their living touring people out, one who tricks them out on bicycle rides and takes them out into nature and just sort of slows them down. So it's wonderful. We have a program goes by the name More Fun, Less Stuff. And certainly a walk in the woods fits very well into the more fun framework. So I just thought you might reinforce that.
Mike, can you find that? If I Googled that program, could I find it online?
You might, if you sent me an email, you would certainly get more than you need. I can get your email from Art.
Oh, sounds great. Thank you.
Okay, thank you.
Okay, Phil.
Yeah, so Melissa,
Sorry, before I go on, Phil, and after Phil is Dave Pollock, and then after that is Gord Kubanek.
You certainly want to follow through with that last questioner. He has a wonderful property that we have explored, and he has some great ideas. But anyway, back many years ago, about 15 years ago, I had an uncle who was hospitalized in sort of the elder care area of the Halifax Central Hospital. And he had been somebody who had lived outside all of his life. And in order for him to be happy, he wanted to be able to have his wheelchair propelled outside, and he wanted some vegetable beds where he could grow his own food and poke about in the soil. And the hospital eventually adopted that, and the nurses and doctors all jumped in with glee because now they had the ability to get out with their patients and experience the outdoor environment. But that brings me to how elder care these days is taking off as for-profit ventures. And as I drive along the very busy main thoroughfares of Ottawa, I see all kinds of elder units that have nothing but pavement around them and huge volumes of traffic going by, so that even if they open their windows to hear a bird, they have the byproducts of the fossil fuel industry that they're breathing in. Is there any way that your groups can influence where these facilities are located, given that the people that are captive in them are really being more stressed than anybody else in the world, in my opinion?
Yeah, totally agree, Phil. And unfortunately, I think with institutions, healthcare institutions that have sprung up over the last few decades, we've lost that connection to nature. Trees for Hamilton, and I believe it's called Trees for Ontario. I'm not sure where you're located, but they in fact are a charity that's dedicated to trying to green hospital grounds by planting trees and advocating for green space. So they would probably be a better partner than Park Prescriptions that just focuses on, prescribers and trying to get them to prescribe nature. Also, I'm part of a charitable organization, and there are rules around advocacy and what we can do. So I tend to do most of my advocacy through CAPE. But I totally hear you. But one thing that I want to mention about these places where people are trapped inside is that bringing nature indoors, even though it's not as good as the real thing, is a way to actually improve health outcomes. There's research showing that just being able to, having pictures of nature on your wall, listening to nature sounds, and I think I mentioned smelling nature can actually improve mental health outcomes and in some cases immune function outcomes. I've had conversations with different physicians within Vancouver Coastal Health and Fraser Health here on the West Coast, where we've talked about doing virtual reality nature. Again, I know it sounds kind of crazy, but there is research showing that people who experience nature in as full a way as possible can actually improve health outcomes. So, so these are ways to bring nature indoors without all the massive expense of greening outdoor environments. But I absolutely think this is essential work that's being that you're talking about. And there are some PaRx leaders in different provinces who have participated in greening hospital grounds initiatives. But I would encourage you to to speak to Trees for Hamilton or Trees for Ontario and see what they have to say. They are actually health system focused charities.
Right. Okay, Dave Pollock. And after that, Gord Kubanek.
Hi there. Thanks. I didn't actually have a question. I was most appreciative of the presentation, though, Melissa. And I was just going to reference when you said a moment ago that there was limitations in terms of what charities can do in terms of advocacy. I've been connected with nonprofits all of my life, and I followed the changes. And there's very little to be fearful of today, as long as your advocacy relates to the mission, the basic mission of the charity that you're working with, and as long as you're not politically partisan. So some NGOs and charities are just catching up with the fact that they're really quite free now to do that. And in fact, you don't even any longer have to file each year what your political activities are. So they've really loosened up in the last 5 years, those restrictions. But thanks once again for the work that you're doing. I found it really excellent.
Very
Thanks. I appreciate that, David. And that's why CAPE has such a voice. I will mention it's less a constraint with the BC Parks Foundation and more the general tone of the initiatives that we take. It's with the foundation is very positive, you know, very like positive action oriented, less discriminatory.
Sure.
So that's another reason why, you know, why we tend to focus on the positives
Oh, yes, I get it.
on
Yeah.
that side. Yeah.
Yeah.
But with my CAPE hat on, I can be as, you know, as assertive and mean as I want.
Yeah, sure. Very good. Gord.
Hi there. Thanks for the chat. Back in the day, I grew up in Southern Ontario. Here you came from Toronto. And back in the day, to find a park and not pay a lot and not have to book ahead of time was very, very easy. And if you want to look along or go around Ontario, you got
Gordon, I don't know if it's just me, but I can't understand what you're saying. I think you're cutting out.
Okay, I'll go outside. Is this better out here?
Yes,
Yep.
and maybe if you're not moving, that might help as
Okay.
well.
Great. So back in the day, when I was a kid, I could just go show up in Algonquin Park and there was always a spot. Now you have to book a year ahead of time if you're lucky. That is similar for all parks in Southern Ontario. Sandbank south of here, you have to book months ahead of time. So I have a question about sort of population growth and accessibility, also price. Things used to be very, very cheap, and now it's actually relatively expensive, many of the parks and staying overnight. So how can we make, with a growing population, what can we do, especially in the population centers, which is, you know, basically the Windsor, Quebec City corridor is, you know, well over half Canada's population. What should be done to make things accessible for the growing population?
Yeah, this is a great question. I think we saw a huge amount of interest in spending time outside in these parks during the pandemic in particular. You know, when all those outdoor venues were shut, we couldn't go to restaurants, we couldn't go to theaters, we couldn't go to malls. So everyone started to head outside. And we had the same issue here on, you know, on the West Coast is, you know, usually in the off season, you can go to a provincial park and no one's there if you're trying to camp, but now they're all booked up. So I think one answer is more green spaces, more accessible green spaces. I know the Environment and Climate Change Canada is trying through Parks Canada to establish, I believe it's 10 different urban parks to create protected areas so that people can actually access high quality nature right close to home. I remember living in Toronto and having to drive at least an hour before I felt like I was anywhere with my family, before I felt like I was anywhere where I felt like I was connecting to nature. Another answer, it's kind of a deek, but teaching people to appreciate the nature in their environments as well, to slow down and notice the movement, notice the green space, notice the birds, and try to have those nature experiences closer to home is another one. So educating people what nature experiences are as well. But I really think part of it is just more access, more parks, more areas that people can go to. And think,
is there any evidence of that? I mean, I know there's national parks being started way up north, you know, like Hudson's Bay and Labrador, and lots of proclamations, but nobody can get there. And so that doesn't help. So I don't see any increase near urban areas at all.
Well, yeah, if you look up, Gordon, Parks Canada urban parks, there are a number of different projects across the country right now to expand basically Parks Canada run green space in near urban centers. So I would take a look at that.
Great. Well, that's wonderful news. Thank you so much.
You're welcome.
Okay, I have two more questions. Peter, and then after that, Sasha, you're on deck.
Thanks very much. That was an incredible talk. I just found it so enthralling, and I am going to share it as widely as I can. I hadn't heard about this wonderful work, and I know a lot of people who will be very interested. I happen to have my T-shirt here on from PEI, which has a wonderful sign, Peaceful Farms and Cozy Barns. And so I've had some experience in PEI. One of the people I'm going to share this with is David Spence, who's in BC and is doing a lot of work with forestry, etc., in his local branch of the Commonwealth Society, underneath something called the Queen's Canopy. I don't know if you've heard of the Queen's Canopy, but the Commonwealth has been designating huge tracts of forest for various purposes. It's very successful. I want to reply to Phil about one particular residence called the Unitarian House, which is right next to the Unitarian Church in Ottawa. And it definitely provides wonderful, peaceful space. In fact, in cooperation with the Unitarian Church, they have a full, what they call meditation garden, which everybody can go out and walk in. And that is a very good space. And I will be bringing your presentation to their attention as well, to encourage the retirement residences to make use of that space. Thank you again.
Oh, I really appreciate that, Peter. Thank you. You know what occurred to me, and this is wonderful that you're willing to share our work, is that in fact within BC, and I don't think this is happening within Ontario yet or the rest of Canada, but we have a goal with the BC Parks Foundation to protect 25% of BC's lands and waters by 2025. And in fact, we've had two major donations in the last year. So one from Dax De Silva, who runs, I forget what his tech company is called, but he made a $14 million donation to the BC Parks Foundation to help with land acquisitions. And Chip Wilson, actually, the founder of Lululemon, made a $130 million donation to the BC Parks Foundation last year, again, to support conservation. And so what the foundation does is, in fact, it partners, it crowdfunds parks, essentially. It crowdfunds conserved areas. So they use some, like a larger gift from a more wealthy donor. And then that inspires people to actually pitch in. And so we managed to crowdfund, I think it's called Princess Louisa. It's a protected, beautiful kind of ocean area. But anyway, this is something that can happen as well if we're looking to conserve more, as these, partnerships between crowdfunding, private partners, donors. It doesn't only have to happen through government.
And how do we convince our premier in Ontario to not demolish a large green space for buildings?
Yeah, health and opportunity framing is my simple answer. Also, elect someone different, maybe. I don't know.
Yeah, that's very right. So thanks, Peter. And Susha, you had a question, and after that, I have one last question.
Yeah, thank you very much. It's very nice. And I was not aware of all the good benefit for walking in the forest. And I'll definitely do that and share it. One other thing coming into my mind is, when we donate to parks or nature trails, and we get charity donations, so which benefits something like 40% or 50% get back in the taxes. But if the forest and parks are so valuable, maybe we could convince the government to make the incentive for parks and nature trails more attractive, rather than 40-50%, make it 80-90%. So it's easier for people to say, okay, I'm not the only one contributing, the whole society is contributing if benefit is extended to 80-90%.
That's a really interesting concept, and I guess the question would be, other people would want to get in on that as well, right? Is our initiative or our area, our issue area is important too, so extend that to us as well. But that's fascinating, because actually the federal government has also created this goal of conserving 30% of Canada's lands and waters by 2030. And so they may be open to that, because if they can raise funds to support conservation, that'll help them reach their goal. So yeah, I would approach your decision makers about that and see what they think.
Are you saying that if I donate and $1 worth of trail, nature trail, the federal government may say they'll buy it from me 30% and I can donate something. I didn't follow what you mean.
Oh, sorry. What I was talking about was not a direct relationship with the federal government or anything, but the BC Parks Foundation has a land acquisitions program where they will create a public campaign anchored by a large donation from private donors, and then encourage the public to pitch in to, in fact, make up the difference in what's required to buy that parcel of land to preserve it forever. And so it's not, so that donation, in fact, is tax deductible, but but it has nothing to do with the federal government.
Because the corporations, sometimes corporations own it. If we can give them an incentive that they don't have to donate 100%, but or 50%, but they benefit more. So it becomes more easier for everybody to donate.
Mm-hmm. Yeah. On the topic of donations, sorry, Richard, I know you want to say something. Please feel free to donate to CAPE for the BC Parks Foundation to support our work, because we are charities, don't have a lot of funding. Most of the work I do in this file is volunteer. So supporting staff is a great way to support the work that we do.
I can see a real, there's a real opportunity here for both, for CAPE to actually collaborate with KCOR, because there's so much area of cross interest, and I think that should be something that should be explored. The second question, in the community where I live, we are in the process of, there's a major development that's going on, it's in the tens of millions of dollars, and actually we're developing a community benefits agreement. Part of that actually does include trying to increase greenness and so forth. And actually your slides would be very useful for that. But the second question, I'm actually spearheading something to develop a microgrid for our own community. And I noticed that you said that 90% of the grid in BC is run on renewables. Which renewable are you using there?
Hydropower. It's dams, hydropower. Yeah.
Well, it's perfect, because to get your slides, and I could head them on to the committee that I'm on that's developing this community benefits agreement, because it's for a big push in this area to really try and develop every opportunity possible, developing greenness, getting people outdoors and so forth. So that's perfect. It's perfect timing, your talk. And
feel free to use them, Richard. Feel free.
Well, sure. If you can send me your slide deck. And then Jean, you want to, and we'll get Jean at this point to thank you at this point.
I see John has his hand up. I'm not sure if he wants to ask a question or what.
Well, we're kind of, John, do you want to ask one last question?
Well, Richard, it's you're both right. I mean, the point I'd like to make is that, first of all, to get onto something which is amazing, the two very sizable donations, Melissa, you just mentioned. I mean, it shows that business, and I fully agree that Lululemon, I mean, it's not a completely unmotivated donation. One can see the link right away. But my point is that your program, that is prescribing nature, is the timing of it is excellent. It couldn't be better when, for us in KCOR, we just finished discussing a presentation on the poly crisis. The point is that, and then I mentioned in passing that this is not a specialist's word. Here we have in the Globe and Mail on just last Saturday, the Earth's poly crisis this is an op-ed article, and the top author is Thomas Homer Dixon, who's in charge of the program at used to be Royal Roads. And in case it doesn't ring a bell, it's the Cascade Institute at Royal Roads University. He was the founding director of the Trudeau Center for Peace and Conflict, and his PhD is on hard-nosed stuff from MIT. That is to say, I don't want to get into details because I don't know the details. Here we are, PhD, International Relations, Defense and Arms Control Policy. My main point is that limits to growth, and by the way, in French, for some reason, I have a feeling it's the passage of time, halt to growth is how that's translated into French. Halt à la croissance. It's much stronger. So anyway, my point is that we seem often in the area of the Club of Rome, we seem to be counting on negative things and threats. So the balance, I think, is very important, and I'm probably the worst sinner because I can see, having been in the nuclear disarmament as well as defense for many years, I can see how badly we as a species are doing. And our poor single home on the single planet is really going to have a hard time shortly. So your program is excellent, and I would suggest you may want to use, if you want to dip into the negative part, the word polycrisis. And when you're out on the Vancouver Island part, at least contact Thomas Homer Dixon, who is really saying, look, this is what we're up against. So it's so great. You have something positive to talk about to balance the so obvious negative things. So congratulations on your work and getting the word out.
Oh, thank you, John. I think one thing that we can grow is protected green spaces. There should be no limits on growth of that, certainly.
No. And Jean.
Thank you very much. It's my pleasure and privilege to have the opportunity to thank you, Melissa, on behalf of the Canadian Association for the Club of Rome. You have given a lot of really interesting and positive information, and it is wonderful to be able to get some positive things that we can put forward to people. So this has just been great. And I really, really thank you very much for the work that you are doing and for giving the presentation to us today. Along with that, I would like to say that for those people who are still here, Canadian Association for the Club of Rome, or CACOR, is also a Canadian charity, and we would strongly encourage any of you who wish to donate to us if you wish. If you are interested in this or to become a member of CACOR, please go to our website, canadiancor.com. There you can find the information on how to become a member of our organization, but also you can look at the Stay Informed section of our organization and get the information for this particular presentation. When it goes up on the web, you'll get the link for that, and you'll be able to see all of the other presentations that we have given. 135 plus presentations that we have are available on the web, and I'd strongly encourage you to do that. So again, thank you, Melissa. This has been a very, very informative discussion. Thank you.